Hi there, my name is Paramedic Lot. What's your name?
Tina.
All right, Tina, what brings you in today?
I'm here for a physical.
Okay. Well, first I'm going to assess your ABCs. So your airway's open because you're speaking to me. Just by looking at your breathing, it appears normal rate and quality, normal work of breathing, and your pulse is strong and regular. So I know the ABCs are intact. And you spoke to me when approached. You appear to have a normal facial expression. Your skin color is nice and pink, and we have good eye contact. How much do you weigh?
132 pounds.
Okay, so about 60 kilograms. So you have good posture. Can I smell your breath? Okay, yeah, it's pretty normal, and good hygiene and grooming. So now I'm going to assess your level of consciousness and your mental status, okay? So I'm just assessing your speech. So tell me a little bit about why you need this physical.
I need it for sports to be eligible.
Okay, so speech has good quantity, good rate, good volume, and fluency and articulation are also good. Your mood appears very stable, and now I'm going to ask you some funny questions to assess your orientation, okay? Can you tell me your birthday?
9/7/2000.
And how old does that make you?
19.
Okay, what year is it?
2020.
And where are you right now?
The doctor's office.
Okay, so because she's able to answer all these questions, I know that she's oriented ×4, and she has a good recent and long-term memory because she's able to accurately recall past events. So now I'm going to move on and take your vital signs, okay? So I'm going to take your blood pressure. Let's see this arm. Okay, 120/80, very good. And now I'm going to take your pulse. Ready, set, go. All right, pulse is 70, very good, and it was very strong. Now I'm going to count your respirations, okay? So just breathe normally for me. Breathe normally. Okay, respirations are about 16, an adequate tidal volume. Now I'm going to take your temperature. 98.8, very good. And let's see that pulse ox. Perfect, 99%. All right, so back to your skin. Your skin is pink, warm, and dry, just what I'd like to see. And let me check your skin turgor. Perfect. Do you have any lesions, like open sores or anything on your body? No concerns today. Okay, let me look at your nails. Well, you've got nail polish on, but they look very healthy and well groomed. So now I'm going to move on and assess your head, okay? And while I'm doing the secondary assessment, I'm looking for DCAT BTLS. So I'm looking for deformities, contusions, abrasions, bruises or burns, lacerations, tenderness anywhere, lacerations, and any swelling. Okay, so when I'm palpating you, if you have any tenderness, just let me know, okay? All right, so first I'm going to assess the head, and the hair appears nice and healthy. Scalp and skull are all intact. Your face looks very good. Everything feels normal here. Now I'm going to look in your eyes. Nice white corneas, pupils are equal and reactive to light. Okay, now look right here at me. Look at my finger. Okay, follow. Okay, good. Her extraocular movements are good. So now I'm going to look in her ears. So the outer ear looks nice and good. I'm examining the canal for any drainage. I don't see any. And you're able to hear me pretty well, right? Okay, so good. We know hearing's intact. So now I'm going to examine your nose. So there's no deformity. And you seem like you're moving good air. Do you have any drainage or anything coming from your nose?
No.
Okay, good. Alright, so now I'm gonna look in your mouth. So open your mouth. Say ah. Ah. Okay, so she opens her mouth willingly. Her mucosa appears pink and moist, which is just what we like. Do you have any jaw tension, any jaw pain or anything like that?
No.
Okay, and your airway is patent, so that's also good. Now I'm gonna examine your neck. So look up for me. Trachea is midline, and even though she's sitting upright, I don't notice any JVD. So now we're gonna move on to the chest. Okay, so with your breathing, your chest wall movement, good expansion. I don't see any obvious wounds anywhere, open or closed, and your ribs are intact, so that's good. Any pain when I palpated your ribs? Or anything? No. Okay. So now let's move on. I want to go ahead and listen to your lung sounds. So, breathe in normally for me. Big deep breath. And again. And again. And again. Okay, now I'm going to listen to the back. Okay, so I listened to her tracheal, her bronchial, and her bronchovesicular, and her vesicular breath sounds, and everything sounds clear and equal on both sides. So now I'm going to listen to your heart sounds, okay? And I'm listening for the S1 and S2. Nice normal heart sounds, okay? So I want to find all of her arterial pulses. So we've got the carotid pulse, the brachial pulse, the radial pulse, femoral pulse, and tibial pulse, and a dorsus pedalis. Okay, and everything looks good there. So now moving on to your abdomen, okay? I'm just gonna palpate your abdomen. Let me know if you feel any tenderness here. Anything hurt? No? Okay. So I'm not noticing any rigidity or tenderness. There's no open wounds. And it appears very flat and soft, which is what I want. I'm gonna also listen to your bowel sounds. And it's very quiet, so I don't think you've eaten recently. When was the last time you ate?
Breakfast.
Okay, yeah, so you might want to go ahead and eat some dinner now. But I palpated all 4 quadrants. Everything appears normal there. So now we're going to look at your back. Alright, and I'm going to palpate down your spine. You just let me know if you have any tenderness.
No.
Anything? No? Okay, I'm not noticing any masses or rigidity. I don't see any scars. You don't have any history of surgeries or anything like that. No? Okay. And no obvious wounds. So now I'm going to check your pelvis. Pelvis is stable. That's good. And so now I got to ask a couple personal questions. Is there any possibility that you could be pregnant?
No.
Okay. Are you having any abnormal bleeding or discharge?
No.
Okay. Any wounds or rashes or anything that you've noticed changing down there?
No.
Okay, good. So now I'm going to go ahead and move on and assess your legs. Okay? So, stick your foot out. All right, push against my hand. Okay? And push against. Good. And lift your leg up, down, left.
Oh.
Right. All right, other leg. Push down. Push against. All right. Up, down, left. Oh, I'll take it. Right. Well, good. So, good symmetry. They look about equal length. Range of motion is good. Your skin looks nice and pink. No deformities noted. No wounds. And You've got good femoral pulses, good popliteal pulses, and good dorsalis spinalis. Now I'm going to assess your arms. Do kind of the same thing. All right, so sit your arms out, push against, push back, okay, up, down, left, right. All right, other arm, push against, push back, to the left, to the right. Now I'm going to feel your pulses. So brachial pulse, nice and strong. Radial pulse, nice and strong. Okay, very good. So all pulses are intact, and I'm not noticing any wounds anywhere. So is there any concerns that you wanted to speak today?
Nope.
No, you feel good?
Yes.
All right, well, everything I see appears normal, so I'm going to go ahead and pass you for your physical and have fun out there playing some sports.
Thank you. Goodbye.